am Dr. Saibi Siham, and I will moderate this session. But first, let me introduce our panelists. Dr. Johra Ulfki, I think she's not here. Mr. Mohammed Amin Misahel, a PhD student. Dr. Suad Boubaqa and Huwa Larbes from the University of Béjaïa, and Dr. Sabrina Zamour and Tiziri Aziri from the University of Béjaïa. Please welcome our panelists. Please, you come and you join me. Thank you so much. So the first participant is Mr. Mohammed Amin Misahel, a PhD student from the university. Is coming? Okay, then, yes, okay. Then Dr. Suad Boubaqa and Huwa Larbes from the University of Béjaïa. They will talk about needs analysis of English for medical purposes, teachers and learners' perspectives. So it's not a family name. So you have 10 minutes.
Okay, no. Okay. Which I do respect. Yeah?
Yes.
Yeah.
Okay.
Okay.
Yes. So good afternoon, everybody.
Okay, good afternoon, everyone. I hope you are doing well, of course. And we really appreciate to thank the organizing team or members. Yes, and thank you all for sharing with us the lunch. Okay, we are very pleased to be here among you today. Thank you. So as you see, our presentation is going to be on needs analysis of English for medical purposes from the teacher's perspective. And sorry, Miss Idris. We are tackling the problem from the teacher's perspective too.
Yes. So English has solidified its position as the dominant language in global communication as it becomes the modern world's lingua franca, particularly in specialized fields such as medicine, business, and so on. So in non-English speaking countries like Algeria, this creates a pressing and urgent need for healthcare professionals and medical students to gain proficiency in English. EMP, or English for medical purposes, a subset of ESP, aims at teaching medical learners with identifiable and special or identifying the specific language needs of EMP instructors, identifying the challenges faced by EMP instructors, and finally providing insights that can inform the development of tailored EMP courses and support programs. As far as the research methodology is concerned, so we have adopted a qualitative approach to conduct a needs analysis of EMP in the Algerian medical faculties. As far as the instrument of data collection, we have relied on an online survey designed for EMP instructors. So the survey involves 10 questions. We have 9 open-ended questions and 1 closed-ended question. I move to the findings of the study. So the first question was, what training or qualifications do you have in teaching EMP? So we wanted to know whether EMP instructors have any formal training or any formal diploma or degree in teaching EMP. So all the participants admitted that they do not have any formal training or formal degree or diploma in teaching EMP. The second question, what are the main goals of teaching EMP? Why to teach EMP? So the participants' responses to this question can be summarized as follows: developing medical terminology, enabling students to participate confidently in medical conferences or academic settings, reading and writing medical papers, and achieving English proficiency for collaboration with international colleagues. Question 3, the question 3 is directed to put focus in the previous question. So what are the different language needs of learners in a medical context? The answers of the participants are understanding and using specialized vocabulary or terminology, research and academic writing, oral communication with colleagues, and understanding medical literature. The fourth question, what type of materials do you primarily use in your EMP lessons? The participants' responses are as follows: authentic medical texts such as case studies, audiovisual materials, and online resources.
Okay, so we carry on directly with the questioner. Question number 5 is about the supports or resources the teachers think that would help them teach EMP. Okay, so all the participants said that offering training will be helpful in the specialized area, providing opportunities to collaborate with medical professionals to gain insights on teaching EMP, and developing assessment tools. And for question number 6, about dealing with the challenges they face, okay, mainly they are insufficient knowledge of medical terminology or vocabulary, and limited student engagement and motivation since they are adult learners, as we have learned earlier. Time constraints in covering the necessary content, insufficient training and assessment and feedback. And the question number 7 says, do you think that the current EMP curriculum meets the learner's need, which is very important. The majority, 90% of the participants answered no. Yes, they have no. Okay, curriculum to rely on. Okay, and only 10 answered by yes. This is it. Okay, for those who have said yes, we asked them about the language aspects that they consider to be most important for medical students. They have all said that the 4 language skills, vocabulary and grammar are very important. Okay, and for the question number 9, which is in fact supporting the question or the no.
Yes.
Okay, justifying the no of the 90% of the practitioners says that they suggest some changes in the EMP curriculum so as to meet the learner's needs. They said that conducting regular needs analysis is really important, enhanced focus on medical writing since they are meant to conduct research and to publish in English, and contextualized vocabulary development, incorporating technology, and focusing more on communication skills. Okay, and the last question we received no answer. Okay, and here we discuss the findings. So the result of the study underscored the critical need for improved EMP instruction in Algerian medical faculties. Teachers recognize the importance of English in the medical field, of course. Yes, the current state of EMP in Algeria is insufficient to meet the learners' need. To address this gap, it is essential to develop standardized EMP curricula that focus on the specific language skills required in medical context. Additionally, teachers should receive more training in EMP methodologies to enhance their ability to deliver effective courses. Yes, and for about the implications, we suggested here 5. In terms of designing tailored EMP programs, providing continuous professional training for EMP practitioners or instructors to equip them with the latest methodologies to teach effectively, focus on communication skills, technological integration, collaboration between stakeholders. And to conclude, we said that the needs analysis conducted in this study reveals a significant demand for enhanced EMP education in Algeria. As English continues to dominate the global medical landscape, it is imperative that Algerian medical faculties prioritize the development of comprehensive EMP programs that equip students with the necessary language skills. By addressing the challenges faced by both teachers and learners, Algerian medical education can better align with international standards and improve the global competitiveness of its graduates. So it's high time to equip medical professionals with the skills to read, comprehend, and communicate medical knowledge in English, which is seen as a vital part of their academic and professional development. And in a nutshell, we say that the needs analysis, in fact, in ESP is itself
Thank you so much, Dr. Boubaqa and Dr. Hawa Larbeth from the University of Bijaya for your insightful presentation. Now it's time, yes, it's Dr. Sabrina Zamour and Dr. Tiziri Aziri from the University of Bijaya who will talk about another point, which is assessment and evaluation. يعطيكم الصحة. سمحي لي ليش صافي بلاصتي حوا. C'est normal, c'est tout à fait normal. Là, c'est le fait que la présentation soit vue par ندخل على نبدا نسعى نبدا نغلط نبدا non je savais même pas que vous étiez j'avais pas les la faculté معانا.
Good afternoon. Good afternoon. Thanks for being here. For those who don't know me, I'm Dr. Sabina Zmour, lecturer at the Department of English, University of Bijaya. I'm glad today to share with you our research, which is entitled Medical Students' Attitude Towards the Shift from French as a Language of Instruction to English, a Comparative Study. Okay, so it was a pleasure to share this work with my colleague and friend Aziri. So we give the floor to her to present, then I will proceed.
Now moving to the statement of the problem. The Algerian Ministry of Higher Education, as you have already mentioned, has adopted a new approach of learning and teaching, which is changing the language of instruction in most Algerian universities, which is to adopt the English language instead of French language. So this has created a public debate among teachers and students, particularly medical students. Now, this created a debate and we can say a gap in the literature. Based on this, our study aims to investigate student, let's say medical student attitudes toward their language preferences in their discipline, mainly in medicine field, whether to assess their attitudes toward the implementation of English as a language of teaching and learning instead of French. Now moving to the aim of the study. Our study aims to find whether there is significant difference among Tizi Ouzou and regular medical students in shifting from French as language of instruction to using English, and whether So the participants of our study are 30 medical students. They are first year. These participants are divided equally. I mean, 15 from Tizi Ouzou University, who were native speakers of Kabyle, and 15 medical students from the University of Ouargla, and they are native speakers of Arabic. The age group of our participants ranged between 18 and 21 years old. Regarding the data collection, we have distributed an online questionnaire to our participants. This questionnaire contains 4 different sections. The first one is about the general information background of our participants. The second one contains questions which aim to assess our participant level in English language. The third one contains questions related to their attitudes, or let's say regarding English as a medium of instruction. The last section is about their attitudes toward using English as a medium of instruction. In fact, the third and the fourth sections are closely related. Now, our questionnaire includes multiple choice questions, items on a Likert scale, and open questions. Now, moving to our findings.
Okay, so regarding findings here, before investigating the attitudes towards the shift from French to English, we explored the students' level of English. So here we asked them to evaluate themselves concerning the comprehension of English. As you can see here, the vast majority of the participants to see themselves that they have a good level in English. Okay, so here we ask them if they think that they will have problems when taking their lectures in English. So as you can see here, the majority, they said yes, So as you can note that these results contradict with the previous ones. Okay. So here on the right we find some reasons why, or some problems like the lack of vocabulary, the facing hard items, the problems in pronunciation, and the problems in pronunciation. Okay. We proceed. So here we move to the second section of the questionnaire, which is English as a medium of instruction, EMI. Here we ask the students if they are exposed to modules using English in their first year. Okay, so they said, the majority they said no. It means that only the minority students are familiar with how the teaching and learning process is conducted in English. So we can say that some students exposed to some modules in English in their first year. So here we ask them, what do you think is the importance of using English as a medium instructions? Then here we find that the majority said that they have many benefits when including or integrating English as a medium of instruction in their studies. So all of them, it means all these benefits. It opens doors to more information than any other languages. It plays a key role in the world and functions as a passport. It is utilized as educational medium of instruction to provide greater options for institutions' development.
Okay, you have only 5 minutes left.
Okay, so I think I will skip all these questions and to compare.
Try to summarize the
Okay.
findings, please.
Okay, this question I think it is important. Do you agree on switching to English? So here, as you can see, the majority said yes, and the minority students disagree with the switch to English. This we may relate these answers to their, for example, resistance to French language. Okay, so here, okay, these we have generated some themes from their answers. The question was about what they think about the idea of replacing French to English. So here we generated 4 main topics, 4 main themes from their answers. The first one is perceived difficulty and challenges. It means that the students, they see that they will face difficulties, like some answers we find it will be more difficult than studying in French. Okay, so we have also another problem, which is adaptation by teachers. It means that the students think that the problem is how the teachers can switch from French to English when they teach. Okay, we have another answers. The answers related to agreement with transition. It means that the students agree with the idea of switching from French to English. And the third theme is mixed or conditional support. It means that they said yes to the shift, but with some problems. And the final theme is cultural and emotional attachment to French. Here we find some students answered with c'est une bonne idée, mais je préfère le français. So they have the resistance to French language. Okay, let's now just compare between the attitudes of the students of Tizi Ouzou and the students of Ouargla. So here, generally, the medical students in Ouargla have a more positive attitude towards English medium instruction compared to those in Tizi Ouzou, which can be attributed to cultural and historical factors, particularly the emotional and cultural attachment to the French language. So here we provided 4 factors. For example, the first one is just historical ties to France. This is, I think, it is clear for all. The second factor, language as identity. So we can say that a language is not just a language, but it is integrated as identity for the participants, for the Tizi Ouzou students, of course. We have another factor here, openness to EMI in Ouargla. It means that since the results showed that the students in Ouargla, they have a positive attitude to a great extent, it means that here that they are ready to the shifts. As a conclusion here, we can say that the medical students tend to have positive attitude to a great extent toward English medium instruction. The contrast in attitude towards EMI between students in Urgla and Tizi Ouzou can indeed be traced to historical and cultural factors, with heritage to French colonialism playing a significant role in shaping language preferences. While students in Urgla appear to approach EMI from a more practical, globally oriented perspective, students in Tizi Ouzou may view the shift as a challenge to their cultural and linguistic identity. So generally, we can say that students are ready to some extent to study English as a medium of instruction. However, they may not be fully prepared to the shift entirely to English. They have developed some degree of readiness or willingness to adopt it as a primary language for their studies. This readiness could be based on several factors, such as their awareness on the global importance of English. And thank you for your attention.
Thank you so much. Thank you so much. Now it's your turn, Mr. Mesahel. Mesahel Mohamed Amin is a PhD student and a member of the PRFU team, and he's working on EMP and medical English and other topics which are related to today's topic. His talk is titled Effects of Digital Storytelling on Enhancing Students' Intercultural Sensitivity, case of medical students at the University of Sétif.
I'm grateful that I'm part of this wonderful audience for the evening. Culture has been thoroughly discussed, even implicitly, in some of the colleagues' presentation, and as of thus, our research today tackles the effects of digital storytelling on enhancing students' intercultural sensitivity. Case of medical students at Farhat Abbas University, Sétif 1. So for the agenda for our research, we have we'll dive into an introduction with research questions, aim, study limitations, key terms and operational definition, lit review, where we'll see what intercultural sensitivity is, digital storytelling and some of the previous studies, research methodology, where we'll highlight our design, and research findings and applications. So technology has brought an immense change to multiple fields, including education. We used to do things differently prior to having computers and telephones and smartphones in our classrooms. Modern advancements has also equipped teachers with tools that not only enhance learning, but even change our view to the language itself and how it's supposed to be taught instead of how to teach it. Still, despite this technological advancement, implementation of technology in the classroom is still rather scarce. We don't see teachers welcome such technological innovation in our classrooms. Consequently, developing culture is also seen as a taboo in our classrooms. We don't really give much attention to culture, and we are always in favor of language. We care too much about how we see language, that the learner needs language, and we just keep it as that. The vessel is there, but what fills the vessel is absent. Culture. Still, language teachers must expend, on the one hand, on their methodologies and teaching to focus just beyond the language and include culture in a way that welcomes the learners and motivates the learners to integrate in such classrooms. So, as of such, we're going to ask the following research questions. What are the effects of implementing digital storytelling on enhancing students' intercultural sensitivity? And would the Master 1 students be keen on, medical students be keen on accepting such technological innovation in our classroom? So Master 1 students, medical students at the university who receive instruction through, this is our hypothesis, digital storytelling, would develop their intercultural sensitivity, as our null hypothesis would not, and our alternative, they would develop intercultural sensitivity. So, key terms and operational definition. So, intercultural sensitivity has been defined as the ability to understand, appreciate, and interact with people effectively from different cultural backgrounds. It's associated with positive and emotional connection to the diverse cultures and the other, not only one's self. The definition encompasses 6 components: self-esteem, self-monitoring, empathy, open-mindedness, non-judgmental, and social relaxation, according to Chen. As for digital storytelling, is the art of crafting interactive and narrative using a combination between text, image, and audio, and video as well. This process leverages digital tools, platform, not only to produce a compelling and engaging multimedia experience, but also to motivate learners into a new environment, to immerse them into a new environment. So, limitation with the study, the significant time required to design such videos is time consuming. Also, the small population size may not provide the generalizability of the results. Also, it would be hard to determine the long time effects of such, and multiple studies need to be taken care of and conducted to actually confirm the results of the current study. So storytelling is simple yet a powerful and engaging tool that has been used previously as a method for cultural transmission. Still, the landscape has shifted in the previous 20 years from just a narrative to using technology to teach culture. 21st century learning is carried via culture. This is our modern life. If culture is not part of our teaching, we're an outdated teacher. Digital storytelling has revolutionized the way we provide stories, we design stories to engage our learners, to provide them with an environment and the context for the story to grow, not just tell it in its plain language. This is a sample of what the video looks like. So we'll have on the right the piece of the text that the image tries to convey, and that's all a part of the story. So the text is connected to the image, and the image conveys in itself a meaning for the text. So for instance, it was a great grandmother's name, and now it's mine. She was a horsewoman too, born like me. The picture is of nature. It's a horse, it's the wild. The name itself carries a meaning, and the image tries to convey that. And it keeps on going, the whole story. It's a video of about 3 minutes. So the story is about a boy and how the boy wanted to take his own trip in the train, and the father lets him, but the father remains in the back of the train, and he keeps on observing the boy. The boy in the story has this feeling. The image conveys the feeling of the trip, and the boy feels that connection, but he's scared. It scares him to be alone, but the parent is at the back of the train. He's there for him, and the story revolves around these cultural themes. The same from this, the same video, and these were the videos that were used. I've brought them with me. If you want to see them, I'll show you later on.
Miss Sahel, you have only 5 minutes, and I can see that you have so many slides, so please.
No, I'll go through them super fast. So
Thank you.
we have around 5 studies that were conducted as well previously on the same topic, or approximately the same topic. These were taken various designs such as descriptive, action research, case study design, mixed method designs that were all proved that technological and digital storytelling approximately is important for medical learners, and it is really needed. And technology has brought motivation to the table. So the methodology. One group pre-post quasi-experimental design. Population covers around 50 medical students, and the sample was 25 students. Duration was a 4-week treatment, a session per week. The tools that were used, it was an intercultural sensitivity scale adapted from the works of Chen, and an interaction engagement, that were the elements. So we have interaction engagement, respect for cultural differences, interaction confidence, enjoyment, and attentiveness. Treatment, these were the names of the stories that were chosen: The House on Mango Street, The Last Carriage, A Journey of Letting Go, The Great Pancake Escape, and The Man Who Planted Trees. And also satisfaction scale. So for the data, for a pre-test, interactive attentiveness was the highest scoring factor, suggesting that the respondents are very observant and attentive in interactive interaction. Still, the interaction engagement was scored below average, suggesting moderate engagement in intercultural interaction. So respect for cultural differences was the lowest scoring one, which is surprising and also concerning at the same time. This could indicate a need for improvement in understanding and respecting other cultures. These were the treatments that were provided in order. So t-test results between the previous and the post-test. So we have sufficient statistical evidence to reject the null hypothesis. We can conclude that after administering the treatment, from the initial point of view, there was an improvement in the intercultural differences, engagement, confidence, enjoyment, and attentiveness. So satisfaction scale, the learners did enjoy the new way of telling them stories. They found it very useful, very attractive. So research questions revisited. Was about whether the implementation of the digital storytelling would be effective, and that was statistically proven. And would the learners be keen on learning with the application? That was also proven by the satisfaction scale. So for recommendation, it's a valuable tool. If teachers are keen on trying this method or approach in their teaching, it is a very good way of bringing motivation to your classroom, but still it's a bit time extensive for teachers. Given the schedule of the teachers, it may be a bit problematic. Digital storytelling is not necessarily a teacher-centered task. You can allow your learners to design their own videos, to bring them to the classroom for a way to discuss with them how they see culture through the videos. Suggestion for further research, investigating the same application with other levels, with other populations. These were my references, and thank you so much for your attention.
Thank you so much. Now I'm going to invite my colleague Dr. Shiyukh Unisa to moderate the second afternoon session, Q&A session. Of course, you will ask questions, but not now. You have to wait, yes, the end of the second session to ask your questions. Thank you so much.
خلي ما نخرب هذه سيبارا D'accord. Je t'attends avant de commencer. اكزاكتومون راح الحل مليح. Okay then, good afternoon everyone. Welcome to the second session of this afternoon of this today's event. So I'm going to call the panelists, so please those who are here join in order to prepare your talks. So here we have first Dr. Halima Al-Khrif from the University of Adrar. She is going to participate with us online. And then we have Siha Boughani from the University of Bijaya. Then we have Dr. Amal Afia from the University of Souqharas. I think that she's here. Yes, good. Then I invite also Miss Asia Sili and Miss Khawla Bousakin from the University of Bijaya. They are PhD students. I think that they are here. Okay. And then I invite also Mr. Ghilas Amarouche and Fouad Bouaden from the University of Bijaya to join us. Very bien. So for the last panelist, it's going to be, in fact, presented by Miss Asia Sili. Okay, so let us start with the one participant who is online. Mrs. Dr. Halima Al-Khrif from the University of Adrar. D'accord, okay. Good afternoon, Miss Dr. Al-Khrif. We are not hearing her.
Good afternoon.
Okay. Good afternoon, Dr. Al-Khrif. First of all, we thank you for being with us from the morning till now. Thank you so much.
Thank you for your invitation.
Okay, so please start your intervention, and I beg you to respect time. You have 10 minutes. Thank you.
Thank you. Journal use the paramedical system, geological, practical, and continuous examination, general nature of medicals. On grammar and vocabulary, but also on specific skills as booking medical appointments, receiving patients, nursing, and so forth, for an efficacious EMP teaching and learning. Here coherently, the adoption of LMD system in Algeria in 2012 brought medical English, EMP, or ME to dentists, pharmacists, but paramedical specialists, whereas physicians or medical doctors, also sometimes midwives, are deprived from learning this module. So, though they are the pillars to transmit medical data to other specialists. So the purpose from this study is to uncover the weaknesses or to advance the factors that enhance the EME teaching and learning in paramedical studies in Algeria. I will move since we have only 10 minutes. So, Research questions are as follows. What are the benefits of ESP teaching, especially in medical setting? Is the time devoted to medical English sufficient for gaining the specific vocabulary for communication? Does the abstinence of course boosts affect the EMP course? Are the English teachers skilled in manipulating medical terms? And whether are they able to provide efficient courses or not, which meet the needs of paramedical trainees? What is their profile, and is it helpful in teaching the goals? Besides, how do students behave towards the English course, and is their level boosting their success? Some hypotheses are advanced as few hours are devoted to teach medical English. Medical course books are totally absent. The English teachers are almost not skilled in manipulating medical terms. They are temporarily appointed. Sometimes they abandon it completely. The English teachers lack ESP training, so they provide basic knowledge rather than EMP courses. Besides, students undervalue the English course. Be the same or changeable, and we have at the end comparisons and of findings in order to advance the results or the factors that enhance EMP teaching. Research design is split into studies. We have panel study, which is adopted with the ENFS PM of ADRAR, especially experimental phase, and the trend study or repeated cross-sectional study with both ENFS PM ADRAR ME and the of Algiers. Here to diagnose the level of students, describe the ME teaching, the current ME teaching, then to move to needs analysis, then course design, then experimental phase, it means to implement it, then assessment, then description and comparison. Here we adopted triangulation, quantitative and qualitative instruments. We based on lists of the baccalaureate mark as an initial level, needs analysis questionnaire, classroom observation, interviews, recording, written tests, and experts' previous experience. Since we have no data about paramedical studies, written data in Algeria. So it will be the first reference, this study for students, medical or paramedical students, to know about the history of paramedical studies in Algeria. We adopted these tools in order to have information about target situation needs, wants, means, present situation learning needs, linguistic, and means needs. So this study adopted a population of 10 responsible members, some administrative agents, healthcare experts, 6 teachers, trainees, a total of 303. The places of study, we have the National Institute of Higher Paramedical Training of Algiers and Adrar, mainly. Complementary data are collected from the Ministry of Health, Ministry of National Education, Higher Education of and Scientific Research, ENFC of Oran, Faculty of Medicine Algiers, and the Intensive Language Learning Center of Oran. Sampling is based on linguistic sampling that suits our situation. We have mainly no probability sampling that leads to convenient or opportunity sampling. It means what is available. Inside it we have a probability cluster. This is adapted to observation and written data, whereas oral performance we have quota judgment. Inside it we have dimensional sampling, and a safety margin is adopted. Limitation of study, we have working with available participants, distance and personal limitations were acted against our reaching our default or results or goals. The data collection, it is divided into 3 phases. We have diagnostic phase, needs analysis, initial, to identify the initial English level, retest and description.
Please, Dr. Harif,
Yes?
please, can you summarize your findings? Because here you have 4 minutes left. Thank you.
So we have, among the findings, we have here the teacher criteria, that ME teachers mostly relied on EGP rather than ESP teaching, and we have also they are based on traditional teaching methods and lacked familiarity with the technical vocabulary. The EMP, it means the person who has ESP training has a methodology that rely on medical familiarity, unlike the ME teachers, and undertook the trainees' needs. Adopt both learner and learner-centered approach, integrate technology, rarely refer to traditional method, manipulate diverse grouping, peer learning, for example, develop the fourth strand, heavily rely on the net since there are absence of the course books. So here we have the AMP course taught the trainees some basic elements, specific skills, and how to identify the meaning of technical words like cardiology, it means cardio, heartology, science, acquaintance with the pronunciation of long and complex words like membranoprophyl relative glomerulopathies. This is long word, it means based on infixes and the stem. Foreign plurals were sometimes confused with trainees since like diagnosis, since it ends with S. Meaning of nouns. Here we have a difference in matter of the meaning. Like illness means acute, disease means chronic. يعني هنا يعني الفرق بين الأمراض المزمنة والحادة. Fundamental skills and interpersonal skills were adopted in this type of teaching. We move directly to the result. Trainees' attitudes toward both English and ME course. Most students love English except the ME course, so they are intrinsically motivated, whereas difficult pronunciation of technical words, ashamed to speak, especially in other rare external use, the lack of time, they have condensed the paramedical system of training, theoretical and practical, with continuous examination. So for that, they are extrinsically demotivated to learn the ME course. ME course needs analysis, identify the points of strength and weakness of students, whether in a matter of written or oral data. Communicative and learner-centered method is suitable to do this type of teaching. Secondary subject, since medical English is undervalued by the organizer or the administrative staff, it is always violated, and sometimes it is replaced by French. Here we have to reconsider the ME language policy and planning. Teachers have يعني, differences in matter of the meta language, temporal jobs mostly, teaching experience tiny, lack of ESP training, unfamiliarity with the medical technology, so that an ESP or EMP training is and the permanent job is proposed. Course books, absent of course books, rare, almost outdated French-based and bilingual books, heavy reliance led to heavy reliance on the net, provision of textbooks and English medical documents is required. ME time in is short, few hours, multiple specialties. It is always or frequently violated at the rate of time tumbling. So we need a hand-in-hand EMP teaching and learning. Classrooms are mostly unfit classes, fixed seat, narrow passes. So we need a language laboratory. This is they are among the findings of this study. Thank you for attention and for giving us the opportunity to participate. Thank you.
Okay, thank you very much, Dr. Lakhri, for your intervention, and mainly thank you for your patience throughout all this study day. Okay, so now we are. Thank you. Now we are going to move to Dr. Siha Boughani from the University of Bijaya, and she is going to provide a talk entitled An Analysis of the Educational Experience in the Online and In-Class English for Medical Purposes courses, case of medical students at the University of Bijaya and intern doctors. So the floor is yours.
Is entitled An Analysis of the Learner's Educational Experience in Online and In-Class English for Medical Purposes courses, case of medical students at the University of Bijaya and resident doctors. So, the emergence of English as a global language is already known for everyone, and everyone is talking about its importance, especially in the healthcare sector. But in Algeria, for decades, the French language has governed this sector. That's why many students, professionals, practitioners found themselves steps behind compared to their peers or counterparts in worldwide. Okay, so training them in the EMP or English for medical purposes ought to be implemented in order to construct effective and successful courses for this category of people. So, Fortunately, with the development of technology, especially with the educational platforms online, it is now possible for the learners, if they want to learn the EMT, they can just go online to learn EMP because there are already accredited platforms for teaching the EMP. But the question is whether these EMP online platforms provide effective courses for the students that satisfy the needs or not. So in this study, we are trying to analyze the educational experiences of the medical students and resident doctors concerning the EMP courses they have received. Also, we are trying to measure the students' academic satisfaction as part of their learning experience throughout these two types of the courses. This is very important. Well, these two aims to be achieved are very important because the analysis of educational experience elaborates clearly many aspects of the educational system, but is showing the reality. Because if we ask just questionnaires about the needs, etc., these results are general. But when we are analyzing the educational experience these learners are learning, this provides accurate results. And measuring this satisfaction by a given educational system is part of the needs analysis as well. This provides an updated needs analysis process. So both are crucial steps in curriculum and syllabus design. It is important to evaluate these experiences to help future curriculum and syllabi designers understand what should be taken into consideration and what should be avoided. So we have three main questions that guide this research study. The first, what are the differences between the in-class and the online EMP courses in terms of content, objective, and evaluation, and which type of these two courses provide better or significant educational experience? And third question, what is the student's academic satisfaction level or rate regarding both the types of EMP courses? So in order to achieve this data, we have selected some common online EMP courses, mainly on the platform of Udemy, University of Sussex, special language or special online course which provided an EMP course. We have the English for Work medical English course. We have two major or accredited courses on the YouTube channel, one for the or made by GG Medicine and the other by the Learning English Pro. For the English or the in-class or EMP courses, we have provided a questionnaire, or we have administered a questionnaire to the teachers of EMP at the university. Only one teacher responded, so it has been taken as a sample for comparison. So we have used also teachers' questionnaire and an EMP learners' questionnaire. I'll just pass to... We have also used a course satisfaction scale, which consists of 17 course elements, which have been divided into 7 subscales. We have the learning environment, the objectives, the content, the teaching methods and materials. We have also the engagement. We have the feedback, satisfaction, whether students are satisfied based on these elements or not. So concerning the results of the study, I go directly to answer the research questions. First, concerning the comparison between in-class and online EMP courses. At the level of target students or the target audience, we have the content, the objectives, the teaching methods and materials, assessment, and feedback. So the comparison yielded in a very that the online EMP courses are richer in terms of content, in terms of objectives, because they are full programs, or they are full syllabi. Whereas the in-class, as I said, only one teacher responded, which is the teacher of second year, and the content of the course was addressed to teaching some medical vocabulary as it is expressed by the teacher himself or herself. Concerning the objectives, we have similar, except that in online EMP courses, they try to familiarize the students with more than the vocabulary, but the syntax and the cultural aspects of the EMP or the English language. For the methods, we can see that the online is richer because there are videos, MP3, subtitles in tablets, and the courses are equipped with discussion forums where the teacher can interact with the students. Concerning the assessment here, the online EMP courses provide reading activities mainly. They base on reading, spelling and writing activities, filling the gaps. YouTube courses have no activities because they are theoretical. Concerning the in-class courses, it includes exercises based on the handouts and the project. Concerning the second question, which is about the educational, the type of education that provides richer educational experiences. From the teacher's perspective, according to the teacher, the in-class EMP course can provide a better experience because of the interaction with the teacher, the possibility of controlling their learning, and in the in-class cannot be disturbed by external factors. And the teacher thinks that the in-class course is effective because it understands the unique needs of the learners and help in tailoring activities to meet their needs. From the teacher's perspective, we asked further to describe the student's educational experience, although they are for, and they say that the in-class is effective, but the educational experience of these students concerning the interaction, there was a poor interaction, and the students were very passive, and the students' activities, well, they watch the teachers as expressed exactly by the teacher. They just watch the teacher, and only if the student responds to the question. Concerning the engagement, there was no engagement, and they do not do the work assigned to them. Few have done the PPT or the project in form of PowerPoint presentation, and it was very poor as it was claimed. From the student's perspective now, and the doctor's perspectives, of course, the types of the courses which provide better educational experience, as we can see here in the graph here, 50% said that the in-class courses provide better or significant learning experience or educational experiences, while 25% said that both in-class and online. We have we have asked the students, or the respondents, sorry, to compare between the two forms of education's limitations. We can see that for the in-class EMP course, the syllabus being taught is not good for them. It doesn't match the needs for them, and because it does not target the oral communication, the course in class is not well scheduled or not being regular with the in-class course. Concerning the challenges of online EMP course, there is a challenging, or the continuity of the program is challenging because most of the online platforms are premium. They require you need to pay in order to carry on the program, and the content is not organized sometimes in the free platforms. They waste time while trying to access the websites and the availability and finding time to follow up the online, especially for resident doctors, since they are busy. Concerning the third research question, the student satisfaction level with both types of EMP courses. As you can see in this diagram, there are mostly the satisfaction level is higher in the in-class EMP course rather than the online one. And the overall scale claims that it is higher, 3.5, a mean of 3.5 in the in-class compared to the online, which is, or the mean is to 87. So this study entails, this study aimed at analyzing medical students and the resident doctors' EMP course educational experience in order to provide a deeper understanding of what should be taught and how it should be taught in the future. So it entails that these students are interested in studying English, but they are in a way lost what they need it for, how are they going to study it. So they think it is an addition for now, since it is not going to be used in the hospitals. So they need it in the research, so it is not used in the hospitals or with patients. So with patients, yes. So it is an addition, not a necessity. So it is necessary to explain the difference between studying general English and English for medical purposes, because whenever you introduce general English course as a basic course, they feel that it doesn't match the need what it is needed in order for communication, sorry. So the in-class courses are essential because of the interaction with the teacher and the learners, and it is essential to provide more time for the in-class sessions to ensure a follow-up process, because it is mentioned in the questionnaire that they only have 1.5 hours per week, and this is not enough for a training. So online courses provide additional resources, and it is highly recommended that the online material should be used as well in addition to the in-class session in order to ensure an effective EMP training. The EMP teacher should make an ongoing assessment of the students' need to avoid boredom in the classroom, and discussion techniques help them in this case. So this study shows that
Okay, thank you, Dr. Bourani, for your presentation. Now we are going to move to Dr. Amal Afia from the University of Soukharas, and she is going to present a talk entitled Integrating English Language Instruction into Veterinary Medicine, Strategies and Challenges. So the floor is yours.
So good afternoon, everyone. Yes. First of all, I'm so thrilled being here among you today in your study day at the University of Bijaya. Thank you so much, the organizers, dear professors, guests, for inviting me to participate in this study day. I would like to introduce yourself. I'm Dr. Afia Amal, from a senior lecturer at the University of Soukharas, specialized in the field of English for specific purposes, option business English, scientific English, and technical English. I prefer to tackle the topic because when we say medicine, we only think about human being medicine, forgetting about the animal medicine. Yes, and since at the University of Soukharas, we have a big institute of vet and agronomy medicine, yes. And some of the professors are my colleagues and friends, and they are struggling with teaching and trying to teach in English. So my topic for this presentation stands for Integrating English Language Instruction into Veterinary Medicine, Strategies and Challenges. I'm sorry, I have to try to go fast as much as I can. For the globalization and veterinary medicine, this profession is becoming more globalized with professionals needing to engage in international research and conferences and collaborations with other professors abroad. And for the second reason, English, of course, has emerged as a lingua franca in veterinary medicine, making English proficiency essential for professional success in the global context of this field. For the adoption of English medium instruction in Algerian universities, this instruction should be there to align with global standards, as we have mentioned before. Also, enhancing academic and professional opportunities to open the doors to students, researchers, and professors to pursue postgraduate studies abroad, attend international conferences, and collaborate on global research projects. Many veterinary students are struggling with studying or learning in English because they have limited proficiency in English because of the predominance of French as a language in scientific education. Secondly, a dominant academic language in science and medicine, and English being introduced as a global language in Algeria. So EMI in veterinary education must navigate this complex linguistic landscape. Why veterinary medicine? Let's talk about the local veterinary practices in Algeria. It is shaped by the country's unique agriculture, environmental and socio-economic conditions, including livestock farming and zoonotic disease management, while local knowledge is crucial. So EMI helps future veterinarians access global veterinary practices and innovations that can be adapted to Algeria's context. For the economic, because when we talk about vet medicine, we talk about the economical aspect of any country. Career development and international mobility. In Algerian veterinarians who are proficient in the field or in English as better positioned to work with international organizations, participate in global conferences and pursue advanced studies abroad. Why? Because EMI can increase their competitiveness in both national and international markets. My presentation will explore the strategies and challenges of integrating English language instruction in vet education. And the focus is on the role of English for specific purposes as an approach. Yes, for the alignment of language skills with vet practice, there should be specific communication tasks in vet practice, including clinical consultations. This is what should be done, of course, not in Algeria as practitioners, but as professors. They should understand scientific papers and convey medical information accurately. For their challenges, they face additional hurdles in acquiring the necessary proficiency to excel in these areas. For the linguistic demands, veterinary medicine has its own specialized vocabulary, as we all know, making we can say drawer, repertoire, and register, making it challenging for learners to master both general English and field-specific terminology. And also professors need to communicate in complex medical register. The limited resources, as we all know, in all scientific fields, as far as the English language is concerned, they lack, many institutions lack resources, qualified English teachers, textbooks, and training programs. Varying proficiency levels, students and professionals, also we can say professors, come with different levels of English proficiency. That's why I recommend always, as a researcher in the field of TEFL and ESP, for all fields in first year students to add a module of linguistic reinforcement in English as a separate module. So for English for specific purposes, we know that we focus on teaching language relevant to specific fields, like the case of vet medicine, ensuring that students acquire vocabulary and communication skills tailored to their field. In this case, language instruction can be aligned with their tasks such as writing case reports, conducting research. I recommend the CLT communication language teaching, which is mainly the approach which is of a paramount importance that emphasizes on real-world applications of language, encouraging learners in general to practice communication in authentic clinical or research scenarios. And of course, the goal is always to improve fluency and confidence in using English in practical professional settings. For the curriculum design, here are the practical approaches. Curriculum design integrates English language into vet subjects such as anatomy, pathology, and pharmacology. Using veterinary-specific content to teach vocabulary, grammar, and communication skills that are directly applicable to the profession. And of course, the peer collaboration, group projects, peer feedback to enhance speaking and writing skills in professional contexts between our professors and other countries' professors. Continuous training for vet instructors to improve their own English proficiency and their ability to teach in English. Workshops, we lack this concept of having workshops as far as technical English, scientific English is concerned, and short-term exchange programs can help instructors adopt EMI techniques effectively and in short time. Provide additional support like tutoring and language labs for students who need it. Here are still about the constraints here. Expansion of international collaborations to support EMI in Algeria. And as a conclusion, we can summarize that the specificities of this field, the veterinary medicine in Algeria, including its scientific rigor, international nature, and local linguistic landscape, and also economic aspect. We have this, we have identified the challenges by adopting English medium instruction in our universities in general, and specifically in this veterinary programs, can significantly enhance student success to global knowledge, improve their professional prospects, and help align Algerian veterinary education with international standards.
Okay, thank you, Dr. Afia from the University of Soukharas for your interesting and insightful communication, because here you have in fact introduced the realm of animals. Okay, so when we think about medical English, generally it is humans, but now you have given in fact importance to the animals, and it is very interesting.
Because I have been invited and called to design the doctoral contest of vet and agronomy science, to design the questions of their exam. From there I have this, that's why I was interested, and I have taught them.
Okay, thank you very much. Now, so now we are going to move to the coming presenters. We have Ms. Assia Sili and Ms. Khawla Buskin from the University of Bijaya, and they are going to deal with exploring target situation English language needs among doctors of Khalil Amran Hospital of Bijaya. So the floor is yours. You are welcome.
Good afternoon. I know you are all tired, so I'll try to be so brief. So let's start directly. So we are going to present our study exploring target situation needs of English language among doctors of Khalil Amran Hospital in Béjaïa. So the outline is as it follows: introduction, theoretical background, methodology, results, and of course recommendations. So let the floor.
So, good afternoon, everyone. So, I try to go fast. So, based on the outline briefly explained by Asia, with the globalization, various fields, including healthcare, English stand as the dominant language for communication and knowledge exchange across countless fields. So in the medical fields as a specific, doctors are expected to master specific English, AMP, to acquire necessary skills for communicating in different medical scenarios. So in this context, particularly in Algerian context, we can find that French remains the leading language for daily medical practices. And also to identify the gap, we can find that many studies discussed medical English within academic purposes, neglecting the occupational purposes or professions. So, for this reason, this study addressed the two main research questions, which are about what are the medical professional scenarios in which Algerian doctors use English. The second one is about investigating the specific linguistic skills and competencies are required by medical doctors to effectively communicate in a target medical context. So based on these two questions, the researchers or the study aims to identify these linguistic situations and at the same time explore the linguistic requirements for practicing doctors.
For the theoretical background, so the importance of English in healthcare is so important as it gives a broader, let's say, access to a literature to allow doctors update their knowledge and enhance their practices, of course, and mainly in high pressure situations, mainly in collaboration with foreigners where they are obliged to use very technical English. So here English remains as an essential skill. As we are investigating target language situation, well, it is important simply because it determines the requirements of what really needs these doctors in their workplace in order to help them to form our doctors to effectively perform in their workplace. As for the EMP in Algerian hospitals, we find, as usual, as we all said, French as a dominant language, but still we find some Darja and Kabyle for general communications with patients. While English stands as an essential skill, it is not really fine, but let's ask the question. We'll find out later on.
So now we move to the methodology. So concerning the research design, the researchers adopted for exploratory research case study, which is appropriate for gaining initial understanding with regard to medical English language requirements, and at the same time explore the related issues in this concern. Also, according to the research approach, the study is like focused on taking qualitative approach as the main approach to collect qualitative data presented in a form of participant perceptions and experiences with regard to their use of medical English within medical context. Concerning the population and the sample, the researchers or 5 intern doctors were selected as a sample, which is considered as a small to be as a representative to generalize the finding. So this study is taken as a pilot or as a pilot study for further research. Yes, for the research tool, the researchers is like opt for the semi-structured interviews as appropriate tool to gain flexible perceptions from the participants. And finally, concerning the data analysis method, we opt for the thematic analysis. Particularly, we opt for the Brown and Clark method 2006 to facilitate the process of identifying themes and give logical interpretation for each theme.
As for the results, our participants, we said the sample consists of 5 intern doctors from the Department of Anesthesia and Intensive Care. And they all have from 3 to 4 years, which is somehow acceptable as doctors, as they already immersed in various experiences and tasks. And then we have the English proficiency. We have 3 participants showed very good commands of English, even general and medical English, and only 2 showed their limitedness in their use of language, while they argued that it is limited to very basic and simple English. And this limitedness is mainly related to their less exposure to medical English in the hospital, at the hospital, and the lack of confidence while using English and training. As for medical language situations, whether really English is there in hospitals, well, surprisingly, we find 3 situations where our doctors use English. We have communication with some foreign patients. They said that mainly during summer, they are receiving a lot of foreigners at the hospital, so they are communicating with them, in fact, in English. Not everyone could talk to them, but some of the doctors succeeded too. And the other situation in participation in medical seminars. The hospital are organizing many seminars, and they are usually encouraged by their say other doctors or someone to use posters, to participate posters written in English. Unfortunately, only 1 succeeded to do it for the moment, but still they are always encouraged to do so. The last one is the use of some medical equipment. Some machines are completely in English, so only few doctors could use it simply because it is in English, but still English is there. And
So concerning the language skills that are most emphasized by medical learners or medical participants, we can find that speaking, or all participants claim that speaking is a crucial language component to be used in medical scenarios, and followed by listening as a main skill, with less emphasis to reading and writing. So to interpret this finding, we can say that speaking and listening as a conversational skills reflect the practicality of medical practices among doctors, also between patients and doctors, and for conducting or for participating in medical conferences. So for the emphasis on speaking, we can find that the limited level of medical learners in participating in medical conferences, so this entails their interest to be taught or to develop their ability in speaking skills. So yes, this is for yes. For other language components, content and techniques, we find that participants also show their interest to learn some specialized texts like anatomy, amniotic embolism, and the names and the functions of some medical equipment. Moving to reading some medical articles and try to master some translation techniques. Now we move to interpret or analyze the learner's perception toward practical actions for medical English.
Please, can you summarize? Okay, thank you. Okay. Thank you very much for your for this speed. So it is a really a challenge, in fact, to gain some minutes. So thank you very much. Now we are going to move to. There is Madame Saibi who's going to. Reyles. C'est pour Dr. Saibi now that who's going to. Thank you, Asia. So now Dr. Saibi Siham is going to present a talk entitled "The Main Challenges Faced by Algerian Researchers in Medical Studies When Writing and Publishing in English." So the floor is yours.
Thank you so much. So my presentation is titled "The Main Challenges Faced by Algerian Researchers in Medical Studies When Writing and Publishing in English." So I'm not going to talk about the importance of EMP and other things which are related to EMP. I'm going to summarize and mainly focus on the main challenges and how to overcome them. Because here we have Dr. Boulanan, and there will be a debate between me and Dr. Boulanan and Professor Idri, because the study, in fact, focused only on researchers. In fact, this is a follow-up study to a previous one that was conducted by the team, including the members of the PRFU and members of the Faculty of Medical Sciences in 2021. Yes, this is a follow-up study, and as I have said, the main focus is writing and publishing in English. So I'm going to start with the importance of disseminating medical research in English, and together we are going to understand why some scientific research can be lost because it is written in other languages but not in English. As you see, this is a picture of the virus, the very popular virus, yes, COVID. Yes, just to give you an example, a real example, in January 2004, a group of Chinese researchers identified a dangerous strain of the virus, la grippe aviaire, yes, that had infected pigs, and of course, it was identified as a very contagious virus. However, their findings were published in Chinese language journals, limiting international awareness. As a result, can you guess? Health authorities worldwide remained unaware of these findings. For how many months? 8 months. 8 months, and when there is a virus, a dangerous virus, it's not nothing. C'est pas rien. 8 mois. Yes? And then the situation improved when one of these researchers presented the discovery at the International Symposium on the Prevention and Control of SARS and influenza, avian influenza, in China on August 2004, bringing the issue to global attention. So this is a real example of how language, yes, or language barriers, yes, can impact research. And this is the case of so many Algerian researchers who mainly publish in Arabic or in French, in Algerian journals, or sometimes in French journals, but not in journals, renowned journals in English. So sometimes their findings are lost. So English, as many colleagues have said this morning, English today is the new lingua scientia. C'est lingua franca, or la langue de la science. Yes, it's the language of science. So as you know that in medieval Europe, it was Latin. Latin was the dominant language of education, science, and scholarship allowing scholars from different linguistic backgrounds to communicate. But today, it's English. It is English, which is the language of education, the language of science, and the language of scholarship. So I'm not going to read everything. Yes, in the history. So as you see, this was taken from a platform, and as you see, Algeria is nowhere. Yes, in the top 10, we see only United States, China, and other countries. Yes, like Germany, Japan, Italy, France, Canada, Australia, Spain. Yes, and you see, yes, the number of documents published with the higher index, H index. Yes, Algeria, as you see, is ranked, yes, 83rd position. Yes. Now, the impact of linguistic dominance on global research dissemination. Yes, English is considered essential and important for getting an article indexed in international databases, such as my colleague has mentioned this morning, PubMed, yes, Scopus, Web of Science, and others. These databases are highly valued in the scientific community because they are widely used and recognized, and being indexed in them greatly increases the visibility and impact of a researcher's work. So as you see here, this is a map which explains or which describes the scientific output. This is, as you see here, I have only mentioned statistics related to Algeria. Yes, the number of documents published in 2023 by Algerian researchers in medical sciences, medicine. Yes, you have here another map. Yes, as you see, Algeria, in Algeria we have only one indexed document in medicine, un seul article. Yes, and this was a surprise. Yes, as you see, this is a source. You can check if you want, if you do not believe me. Yes, this is the source. So as you see, I was surprised too. Yes, a discussion. So the images show that Algeria had only one indexed document in medicine in 2023, according to the source. And it mentions that Algeria had produced a total of more than 8,000 scientific documents, highlighting how scientific output in Algeria is very low. This doesn't mean that our Algerian researchers in medical sciences are not working. On the contrary, they work, they publish, they participate in many congresses and so on. But their studies are lost because they are not written or published in English. Now, the impact of linguistic barriers on researchers. So, linguistic barriers impact researchers, not only researchers as persons or as researchers, but also their careers and their scientific development of their countries, particularly for those researchers who come from low and middle income countries like Algeria, where English is not the primary language. Yes, another impact, it's the stagnation of local research capacity. Yes, some recommendations to reduce linguistic barriers and foster greater inclusivity in knowledge creation and dissemination. And I really wanted to, the rector to be here because there are many recommendations. Yes, I think that there are many things we as teachers at the Department of English and also teachers at the Faculty of Medicine, yes, we can do so many things together. We can collaborate, we can create so many things. So the first recommendation, the government supported editing and translation services. Because as you know that many researchers in medical sciences, sometimes they write their manuscripts or articles in French and then they translate. And sometimes they know how to translate, how to use, for example, some tools. Sometimes they ask for help. But that help sometimes is not a professional one. No. So one thing that the university can do is to create an editing and translation service in our university, and in this way we're going to help researchers in medical sciences. Creating, yes, international bilingual or multilingual journals specialized in medical research in Algeria and even elsewhere. So many journals, as you know, well-reputed journals, yes, in PubMed and Web of Science, they only disseminate articles in English. But for me, as I see it as an Algerian, it would be better to disseminate the study in English and the original article in French. And this will, of course, give other researchers the chance to read in both languages. Pourquoi pas? C'est-à-dire, dans le même journal, l'article, l'original en français et en anglais. Les deux versions ensemble. Yes? A third recommendation, revisiting editorial policies in international journals. Many international journals, they privilege language more than content. It's very sad because Algerian researchers in medical sciences as well as in arts and other disciplines, they do not write like American or Australian or British researchers. So as maybe we have here some cases of researchers who have tried to publish in well-known journals, but their papers have been rejected because of language. Sometimes these journals even offer some services. C'est payant, hein? Yes, you have to pay, it depends on the number of words. $300, $400 et plus, yes. I think, yes. So why not maybe revisiting some policies in international journals? Maybe editors should be more tolerant, yes, with researchers who do not use English or who do not speak English as a first language. Then, speeding up the publication process for high-impact research. As you know that in medical research, time is really important. So any delay in publication can really impact the progress of scientific discoveries. Another one, yes, another recommendation for writers, for researchers who want to publish in English. Yes, they may use software and writing tools for manuscript preparation. Yes, instead of paying, I do not know, money, tout un salaire, $300, yes, they can maybe train themselves, or the university can also offer this service, accompagner les chercheurs, ou yes, peut-être des stages, hein? Why not, yes, how to use these tools to translate. Then creating university-based writing centers. I think that this is the third time or the fourth time I talk about this project. The rector is not here. I really wanted him to be here, yes, and to insist on creating a writing center. And in this writing center will offer help to all research.
He was here for five minutes. I think he was here.
Yes, ask for help. For example, teachers of English can correct, can edit, can proofread, can help also these researchers, yes, yes, with form. Yes, with form, how, yes. The last one, I think, yes, incorporating academic writing and publishing courses in medical faculties. Yes, courses how to write in English, how to publish in English, but only for researchers at the Faculty of Medicine. Thank you so much.
Okay, so thank you, Dr. Saibi, for this insightful presentation. Now, I don't know if we have enough time for a debate, or there will be no debate. We don't have enough time, I think, for this. You are going to close the sessions. Okay, then. The floor is yours, Professor Ahouari. Okay.
All people are important.
Ladies and gentlemen, of course, after a long day of debate and the richness of all the communications and the conference talks we have attended today, and because of the interesting topic, it incites many ideas related to English for medical purposes, and I see that there is a lot of maybe content to be developed after this conference. So as we have attended, we started the keynote speeches by the experiences of people who have been in the terrain working on medical English and within the medical staff for years. Let alone myself, I've been in a project, Dr. Amina Zian Sharif, who is really apologizing because she needs to leave, and she really liked the conference and its content. So she is thanking everybody taking part of the conference, and Dr. Mariam Boulanan, who really attended all the conference because of her interest in this field. So because of these people are in the field of the School of Medicine or the Faculty of Medicine and Research. So we try to talk about the generalities, broadly speaking. And then the other talks are, most of the talks are part of case studies. And what we appreciated that the studies were at different levels. We have seen those who worked on second-year students, third-year students, residents, internal doctors, and even pharmacy, I think. And the last one was about the veterinary, and really we congratulate you because we completed the circle. Really, she completed the circle. So, of course, our colleague from ADRA also, she could not attend because of her professional commitments, but she decided to share her experience as a doctoral student because she is in the medical field, but she is a doctoral student working on medical English in Algeria. So the success of the conference is here is putting all these people spread nationally in different universities and who are also working in the medical field with professionals in ESP conducting research on the medical field and put together, because we need to share our discussions and our findings in order to say why we have not yet started. So the conclusion we reached at the end of this conference that medical English has not yet started. And we are inviting stakeholders to listen to our research findings and to our recommendations and try to start a strategic plan, nationally speaking. I would say that our recommendations lie on many major elements. My presentation lied on the creation of the EMP Center, English for Medical Purposes Center, where it goes from students at an early stage of learning in the Faculty of Medicine to nurses, to students of pharmacy, to residents, to teachers, etc. It means that everybody should be within the training. So training is training of trainees is part of the recommendations, because we have heard, I think Dr. Zian Sharif talked about this point. We need also to encourage funding such kind of projects. Nothing can succeed without having funded projects with timeline, a timeline for completion as any kind of project. If I have talked about the PRFE project, it's 4 years. It's funded project by the ministry, but it's 4 years, and we need really to give a report in 2 years, and then after the 4th year. It means when we have funded projects, so we can oblige people to provide results. Among the recommendations as well is to cooperation, international cooperations and national collaborations as well with the socio-economic sector. Why not working with some private schools and with the intensive language center we have in universities in order to create an arena where all counterparts can work together in order to achieve such a goal. So these are some recommendations only, but of course the written recommendations will be published on our Facebook page, faculty's Facebook page. So by this, I think that it is more than 5 quarters, so people would like to go home. Bien sûr, ça va venir. I've just started closing the ceremony. So, as I said, everything will be put online. Why it will be put online? Because we have people behind the scene, our technicians, the web TV of the faculty. Thank you, Said, for your help and your support. And you're obliged to learn English now because we are talking everything in English, saying everything in English. Okay. Very good. He's a good listener. So we say thank you for accompanying everybody here. And we thank the faculty staff, on its head, the Dean of the Faculty, Professor Bektash Murad, who has been here just moments ago. So he is accompanying every single step of our achievements. And we end by thanking our rector because he supported all our events and facilitating the process. Because without funding, as we say, without the accompaniment of other people or the administration, we cannot really organize anything. So thank you for the participants. Thank you for the organizing committee. Thank you for the scientific committee. Thank you to myself because I chaired the event. It's just to have something to finish with a smile. So I invite you to take a group picture in order to finish with good grounds. Thank you very much and see you on September the 26th for another national conference.
Thank you.